Thank you, Mr. President. Now, before I begin on the nomination before us, I would like to first echo what so many of my colleagues, Democrats and Republicans, and millions of people across the country have made very clear today. Enough with all the partisanship around health care. Enough with playing politics with people's lives. And enough with the repeated attempts to roll back all our progress and move our country backward. It is time we drop Graham Cassidy, drop Trump Care once and for all, and join together to actually work to improve health care, starting with acting right now to lower premiums for families and strengthen health care in a bipartisan way. That has been my message to colleagues all along. And the truth is, I know many of my Republican colleagues prefer a bipartisan route. They've said as much in the last Trump Care debate, in the very productive discussions we have had in and outside the Help Committee, and in many of their comments over the past few days. So, Mr. President, it begs the question, why are we in this spot yet again? People across the country have been demanding for months to turn the page on Trump Care. But instead of working in a bipartisan way to actually help people, a few of our colleagues have now pushed through yet another reckless repeal bill that is even worse than the previous Trump Care version. It is a bill that will increase costs for families, especially seniors and people with pre-existing conditions. It will allow insurance companies once again to charge people more for basic health care, like maternity care, mental health services, and more, and take away women's access to care at health centers like Planned Parenthood, and result in millions of people across the country losing their Medicaid. And just like last time, the bill has not been subject to any real hearings, public debate, or even a complete and thorough CBO score. Let's be clear, this bill is not a new proposal. It's not serious policy. It is not regular order. It is yet another version of Trump Care that would be devastating for people across the country. So, Mr. President, this is actually pretty simple because there is a clear alternative path before us. Let's do what my colleague, the senior senator from Arizona, and so many others have so bravely called for once again and return to working together. As I've said, I wholeheartedly agree with my colleague from Arizona that the right way to get things done in the Senate, especially on an issue as important to families on their health care, is through regular order and finding common ground. And that's why I am still at the table, ready to keep working, and I remain confident that we can reach a bipartisan agreement as soon as this latest partisan approach by Republican leaders is finally set aside.